Okay.
Peace, I'm Mayaba. I'm a mother. I'm a pre-med student practicing to become a gynecologist. I'm a doula, and I'm also a herbalist. So my experience my birth experience started with me having a doula, and our first plan was to actually just kind of birth at home. So we decided that we just kind of get some appointments at a OBGYN, which happened to be a man, but I thought that because he was of African descent that we kind of like see eye to eye on things, but that definitely was not it. I felt very pressured a lot to take different tests. I felt uncomfortable every visit. I just didn't feel welcomed. I didn't feel like I would even want to go there I just didn't feel welcome enough to even get checkups to make sure that my child would be okay. So eventually I ended up finding a midwife. Eventually I found a midwife who took Medicaid insurance and who could also take my other insurance as well. I feel like birthing with a black midwife would benefit a black mother, because she would understand a mother coming from an emotional and a physical standpoint for sure. I mean, just birthing with someone is white, like, it's great because it is a midwife and it is out of the hospital, because right now we can't really like trust them. So while that is great to have like a white midwife, it's just beneficial for black mothers to have black midwives because they just understood more, just emotional, just physically, they understand our bodies. Cultural, like that's a big thing. Cultural backgrounds, just being different. Just birthing with the...
It's Anya Willoughby, and I am a doula here in Houston. So a doula is a support person who helps pregnant families. We provide emotional, educational, and physical support during the pregnancy, labor, and postpartum period.
What made you want to become a doula?
So my journey to becoming a doula is a little bit different. So I actually have a background as a nurse. I worked as a nurse for 16 years. And as you've probably heard a lot of nurses who are no longer working as nurses say, I burned out and went to teach for a little bit, but realized really quickly that I really miss taking care of women. And so I found that working as a doula gives me that satisfaction that I had in working with women, but I created my own lane. So in general, the health crisis is that women in the United States is one of the countries that has a high mortality rate. We have, of developed countries, we have the highest number, which is a bad thing, meaning that we have a lot of women who are having complications that sometimes even result in fatalities, whether it's for mom or baby. The way we see doulas working now has become necessary because we've gotten away from that familial village support system. And so, you know, in other countries, back in the day here, whenever a woman was having a baby, it was her family who surrounded her, usually the women in her village or the women in her family that would be there. And we're so globalized now, and families move far apart from each other. And so, especially here in Houston, what I recognize, and a lot of the clients that reach out to me are usually people who are transplants to Houston, or they're not living close to family. And so they hire doulas because they want that family, that familial village type of support.
So my name is Frances Coleman, and I'm a midwife, and I became a midwife after I had my second pregnancy, and they were twins, and they were a beautiful surprise, but yet they were another C-section. So my first pregnancy was a C-section, and they were a repeat C-section. And so my journey to midwifery started there. And it all happened because I was like, how did I get another C-section? How did that happen when I felt like I was doing all the right things? And so halfway into that kind of mental thinking and process, I was meditating in the shower because that's the only place I get peace. And the word doula came in my brain. I was like, a doula? What's a doula? Not what's a doula, but I had a doula for my first birth, but I wasn't like overly intrigued by doing such work. So I went and I became a doula, and maybe 3 to 6 months in, I met Afua Hassan, and she is a local midwife here in Houston who was just fantastic. So I went and talked to Afua, and she was like, yeah, I think it's something that you should do. So maybe a month after that, I began my journey, and I began that journey with her. And being with her as a student and a precept, and her being my preceptor, I learned a lot about the traditions of Black community, Black birth, and how the midwife is an integral part of that, and how we just don't deliver a baby to a family, but we help create a family, and we help create community. And it's not always about, you know, are you eating green leafy vegetables? Or like, yeah, you probably are doing those things, because most women want to do the best they can in pregnancy for their baby, but it's more so like, how's your relationship? How are you feeling about this pregnancy? How's your job? How are you managing being pregnant and going to work? Like how, because those things matter, and they come out in birth. And when you address them and have women kind of connect to pieces of their self that they may not normally, it's fantastic. And a birth just happens. Now, I'm not saying all birth goes smoothly, but mentally the mom is much more present and much more connected to her process. So that is how I got to midwifery. And now that I am a professional midwife and licensed here in the state of Texas, it's the best thing I could have ever done with my life. I left a job where I was making nice digits and it was an 8-year career that I loved, but I wasn't completely happy in. And now that I'm doing midwifery, I wouldn't do anything different. I would be, this is what I do all over again, over and over and over, all the tears, all the frustration, all over again, because it's just fantastic. And I love empowering women. I love learning through my experience and giving that to other moms and helping them fight for what they want and helping them do that and showing them different paths to do that. And that's what midwifery is. It's relational. You know, it's a relationship between not only you and the mom, but you and the baby, you and her partner, you and her family. And it's just so beautiful to see when you meet people and they just transform into, you know, a little seed into this flower. I know it's also like weird and corny, but it's so true. It is no known secret, okay? It hasn't been. It's just all of a sudden, I guess, people need something to talk about. So when I went to grad school a long time ago, I went in California, and I was the first time I'd ever heard, ever in my life hearing that Black babies die more than white babies. And I went to grad school in 2004. I was like, what? I raised my hand. I was like, are you lying? Like, that doesn't make any sense. What do you mean? What do you mean? And that doesn't matter if you're rich, poor, educated, not educated. We are all on the same playing field. You're gonna go in the hospital and your chances of dying and your baby dying are high. And those numbers are 3 to 4 times more so than our counterparts. That's Hispanics, that's whites, that's everybody. We are 3 to 4 more times likely to die or have some type of traumatic experience in a hospital setting and having our babies than any other race in this country. And that doesn't matter. You could be, it could be me, masters, my situation can look exactly how a white person's situation looked or an Asian woman's situation looked. And me, 3 to 4 times more likely to die, or to be mistreated or to be traumatized in my birth experience than the other 2 groups. And why is that? Why? I know, like, why? How can that be? Racism.